when you do the pregnancy test in an early pregnancy. So one line may be faint compared to the other. Your body system might be different from someone else's body system. Hello guys, and welcome to my channel. Okay, so today we are going to be talking about the early signs of pregnancy and how you could confirm that you're pregnant. So pregnancy is basically when the sperm fertilizes the egg to form a baby. These signs could help you to check or confirm whether you're pregnant or not. The first one here would be missed period. Okay, so when you've noticed that you've missed your period after a recent unprotected sexual intercourse, then you may be pregnant. Okay, so here you would need to do the pregnancy test using your urine or blood sample, and this is best done in the first week of the time you missed your period. And this pregnancy test would help to detect the hormone. When this hormone is detected in the urine pregnancy test or blood pregnancy test, usually confirms that the person is pregnant. The pregnancy test strip is meant to have two colored lines for one to confirm that they are pregnant. Okay, so the two lines indicate the control and the test line. Sometimes you may have one line being fainter than the other, but they actually have to be the same thickness. Okay, so usually when you do the pregnancy test in an early pregnancy, so one line may be faint compared to the other, but that doesn't rule out the fact that you're pregnant. Okay, so the best thing here would be doing the test the accurate way, which I'm going to discuss very shortly. And when you've done this and you see the control and the test line, then you know that you're pregnant. But if you just have one line, then it's usually a negative test. Or when you have like only the test line there with no control line, then it's usually an invalid test result. So how do you do this pregnancy test using the test strip? First of all, you have to get a clean, dry bottle. Then you put your urine sample inside there. Then you get your test strip. So when you check, you see the test strip, there are usually markings there that are pointing downwards. So once you've gotten your urine sample in the bottle, you use the test strip, you dip it inside the bottle, okay, ensuring that the arrows are pointing downwards. And there usually a stop line that is indicated on the test strip. So this stop line is for you to stop when you're dipping. Do not allow the urine sample to go above the stop line. So once you've dipped it there, you leave the test strip in the urine sample for 8 to 10 seconds, and then you bring out the test strip and place it on a dry, flat surface and wait for the result. The next sign that could show that you're pregnant would be morning sickness. Okay, so people that are pregnant may feel nauseous or even vomit. Okay, but this doesn't really happen to everybody. Your body system might be different from someone else's body system. Okay, so you might see somebody during an early pregnancy that may not really have these disturbing symptoms, whereas you might see someone else that would have like these symptoms, and it could make the person very uncomfortable. So you could have nausea, you could have vomiting in early pregnancy, but in a situation where you're having persistent vomiting and you're feeling very weak, then you may have a condition known as hyperemesis gravidarum. So here, the person has, persistent vomiting, usually a severe one. They can't even keep fluids in the body and they are very weak. So this particular condition would require the person being hospitalized, and they would be given fluids and nutrients through an intravenous access. So who are at risk having hyperemesis gravidarum? So people with a history of hyperemesis gravidarum in their previous pregnancies could have that. Okay, people with multiple gestations, like twin or triplets pregnancies, then people that are pregnant for the first time could be at risk of having this hyperemesis gravidarum. Then lastly, people with gestational trophoblastic neoplasia could also be at risk. So what is this gestational trophoblastic neoplasia? So these are basically tumors that develop into the placenta during the early stages of pregnancies. Okay, so example here would be the hydatidiform or molar pregnancy, and this could be partial molar pregnancy or complete molar pregnancy. So in the partial molar pregnancy, here the embryo doesn't really form a viable fetus. Okay, so that pregnancy is not like an ideal pregnancy because the fetus is not viable. Then in the complete molar pregnancy, no fetus is actually formed. Then cases like this, maybe you may have to do a beta HCG test, to help to confirm this condition, in which case the beta HCG levels will be very elevated, like markedly elevated levels. Also, an ultrasound scan can also, support diagnosis. Another sign that people may have would be, feeling very tired and fatigued. Also, they may have, swollen breast and tender breast too. People may experience mild cramps, okay? And I said mild cramps, not like severe persistent cramps, because when you experience the severe persistent cramps, then it could mean that there is a problem. So you'd have to see your healthcare provider, you'd have to see your gynecologist or fertility physician ASAP, to help evaluate you and rule out, possible miscarriages. Then the last sign that people could have to help confirm pregnancy would be food craving. So people may tend to crave more like foods more often than they used to when they were not pregnant. Okay, then people may also have food aversions too. So they may tend to dislike foods that they used to like or enjoy previously. It doesn't mean that the person is abnormal. So these are just basically signs that could show that the person is pregnant. That brings us to the end of this video. Hope this video was a very helpful one. Please do not forget to subscribe to my channel. Don't forget to like, comment. Any questions that you have, I'll address them in the comment section, and I'll be seeing you in my next one. Bye.